Look, we thought that it was, number one, it's important when we're noticing the increased numbers, the surge that's taking place all over the country. And yesterday in the country, for the first time, there were more than 100,000 cases of coronavirus that was reported. And then we've noticed a modest increase of coronavirus cases here in the city of Houston. Today, the Houston Health Department reports 302 cases of COVID-19, bringing Houston's total to 86,071. There are 4 newly reported deaths. Again, there are 4 new cases, bringing the city's total to 1,357, including, and then you can look at the breakdown that exists. Earlier this week, Houston's COVID-19 positivity rate inched back up to 6.7% for this week. Last week it was 6.5. The week before that it was 5.6, and then it was 5%. So the goal is to get it to 5 and below, and quite frankly, to crush this virus. So we're inching up, and we're just wanting to raise the red flag so people can be reminded of what they need to do in order for us to manage this virus. Houston's COVID-19 positivity rate, daily new cases, and hospitalization increased for the first time since the summer surge. This should concern all of us, especially as we enter the holiday season when people spend more time indoors and traditionally gather with family and friends. So again, let's be mindful of what is happening around the state and the rest of the country. Yesterday, for example, El Paso reported more than 3,000 new COVID-19 cases in a single day. That's El Paso, more than 3,000. And nationwide, of course, the coronavirus cases exceeded 100,000 in one day for the first time. We don't want to go back to where we were in June, July, and August. We really don't, where the hospitals were in their phase 2 of their surge capacity, and everyone was scrambling. We don't want to go back there, and the best way to prevent that from happening is for us to continue to put on these masks and to wear them at any point in time when we're in the presence of others. We have the power and the responsibility to work together to keep businesses and schools open and protect vulnerable populations. The message remains the same. We all know what to do, and that's masked up, social distance, wash your hands, and get tested. Again, we have all these testing sites that are open. You can get the results back in 24 hours. People are getting the results back in 24 hours, okay? So please, there's no reason to fear getting tested. There's no reason. So get tested, stay masked up, and, follow your mayor. I wear one. I carry one as a spare, okay? So, come on. These things do work. Get one that goes with your outfit. Put your little face on it. Cartoon character, that's me. Put your name on it, council member. But this is our vaccine, okay? For now, this is the vaccine. This vaccine does work. So just want to be mindful of that. 100,000 cases reported in the United States in a single day. That's a record, okay? So it's in our control, and let's do our part. Dr. Persse.
Thank you, Mayor. I just want to reiterate something the mayor said. So El Paso, as you know, is a much smaller community than the city of Houston, perhaps a third the size. They had 3,000 cases in one day. So if that were we were at the same pace, that would be 9,000 cases in the city of Houston. So the point is that El Paso, the people in El Paso are really no different from the people in Houston. Certainly not biologically, they're no different, right? So what's going on in El Paso could certainly occur here in Houston. But we are at a point now where we are still able to get control of the virus and how it spreads in our community. We've done it twice. And, when you have a wave, there's that upside of the wave when the virus is good. The reason there's a downside of the wave isn't because of the vaccine. We don't have a vaccine. It's because people wear masks, they wash their hands, they social distance. These are the individual practices that slow the virus down that we can do today. And so as we look forward over the next several weeks or months, we need to keep El Paso and Lubbock and Amarillo and the Valley, because all of those communities, unfortunately, are having trouble. El Paso is the worst, but the other communities are having trouble. That could potentially happen here, but we can potentially stop, not potentially, we can absolutely stop it from happening by doing what we've done 2 times before. Now, that's going to be a little bit different now because you've got holiday season coming up and you've got, the weather changing and some other things. All more reason for us to double down and pay attention to what we're doing. We've done it before. We need to do it again. And then the other couple of things I just want to point out is flu vaccines are out and available. We are entering the flu season. One of the problems that we may face in viral season is if somebody's got symptoms and they didn't get their flu shot, they're probably going to think, oh, it's just the flu, when in fact they have COVID and they're spreading it. So one thing that you can do is if you get your flu shot now and you get symptoms, it'll be far less likely that it's the flu, so you will know quickly to quarantine yourself so you don't spread it. And remember, the persons that you are most likely to spread the virus, the number one group you are most likely to infect if you have COVID is your very own family. So there's a very, very good reason for why we want to stay on top of this. So get your flu shot. Number two is to remember that other illnesses are going to continue to occur. People are going to have heart attacks, and they're going to get infections, and they're going to, other than COVID, and they're going to, strokes are going to occur. And people need to know that hospitals are very safe places to go today. We continue to have a problem with people becoming increasingly sick at home before they seek care because they're afraid to go to their doctor or to the hospital. Those fears are completely unwarranted now. The hospitals, the doctor's offices, the clinics, they are all very safe places to go. So if you have symptoms and you think you need medical help, reach out early when your medical problem is going to be smaller and easier for the doctors to take care of. Don't wait until it becomes a big problem. That is no longer a concern. And with those two things, Mayor, I turn it back over to you.
Ahora en español, Councilmember David Robinson, in Spanish.
Gracias, señor alcalde. Lo que estamos aquí para decir a nuestros ciudadanos en Houston es que estamos conscientes sobre lo que está pasando en El Paso y lo que en este caso es que hay cosas aquí en Houston que es muy importante que guardamos, que no estamos inútiles. Necesitamos hacer lo que podemos para asegurarse que no pasamos otra vez en lo que pasó este verano y estamos vigilantes sobre este virus, la coronavirus, y con eso estamos vigilando lo que está pasando en otros sitios en Texas. Y hay que vigilar que los días que vienen con la Navidad y con el Día de Gracias, que estamos conscientes sobre lo que pasó y está pasando en El Paso y otras ciudades en el Valle, también en Lubbock, y que no regresamos en Houston a lo que pasó este verano pasado. Y por eso estoy muy agradecido a nuestro alcalde, al señor del médico Persse, y hacemos lo que necesitamos hacer en Houston. Por eso hay que vigilarnos, por favor, ciudadanos de Houston, hay que sobrevivir y pasamos para vivir otro día. Es lo que dice nuestro alcalde. Gracias.
Thank you so very much. I was planning on doing that, but my voice is kind of getting a little tired, so I'm thinking, but you said almost everything that I wanted you to say, so gracias.